I am detecting a quorum with myself, council members Benton, Bradford, Evans, Gregg, Weiner, Swara, and Nash being present. I do have a proposed consent agenda, which includes items I'll read through the items that are going to be on consent, then I'll read them into the record and wait if anybody wants anything removed from the consent agenda. But it currently includes items number 3, 5, 6, 8, 9, and 10. Before reading those into the record, is there anything that anybody on the committee wishes to remove from the consent agenda? Seeing none, I'll go ahead and read those into the record. Item number 3 is RS 2026-1908, sponsors Toombs, Huffman, Coopin, and Gadd, a resolution accepting a grant from the Friends of Animal Care of Metro Animal Care and Control to the Metropolitan Government, acting by and through the Metropolitan Board of Health to provide funding for emergency medical care, the Safety Net Program, and the Foster Program for Animal Shelters. Agenda item number 5, RS 2026-1119, sponsors Toombs, Huffman, Welsh, Allen, and Gadd. A resolution approving an application for a Victim of Crime Act VOCA grant from the State of Tennessee Office of Criminal Justice Program to the Metropolitan Government, acting by and through the Office of Family Safety for funding to supplement staffing for both family safety centers. Item number 6, RS 2026-1912, sponsors Toomb, Huffman, Welsh, Allen, and Ewing, a resolution approving an application for a statewide fatality review technical assistance program from the Tennessee Department of Finance and Administration, Office of Criminal Justice Programs to the Metropolitan Government, acting by and through the Office of Family Safety to fund and promote a coordinated, multidisciplinary approach to improving the criminal justice system's response to sexual assault, domestic violence, dating violence, and stalking crimes. Agenda item number 8, RS 2026-1914, a resolution approving sponsors Toombs, Huffman, Welsh, Gadd, and Ewing, a resolution approving an application for a Victim of Crime Act grant from the Tennessee Department of Finance and Administration, Office of Criminal Justice Programs to the Metropolitan Government, acting by and through the Metropolitan Nashville Police Department to fund counseling and victim advocate positions, purchase supplies, and subsidized travel. Item number 9, RS 2026-1915, sponsors Toombs, Huffman, Welsh, Gadd, and Ewing, a resolution approving an application for a Project Safety Neighborhood Grant from the Tennessee Department of Finance and Administration, Office of Criminal Justice Program to the Metropolitan Government, acting by and through the Metropolitan Nashville Police Department to reduce gun-related violence in Nashville by providing funding for overtime for investigation of violent crimes involving guns and the enhanced use of data analysis, as well as agenda item number 10, RS 2026-1916, sponsors Toomb and Huffman, a resolution approving an application for a community traffic safety enforcement and education grant from the Tennessee Highway Safety Office to the Metropolitan Government, acting by and through the Metropolitan Nashville Police Department for community-based efforts that employ highly visible and sustained enforcement coupled with community outreach events to address impaired driving and other unsafe behaviors. After having read those into the record, is there anything that needs to be removed from consent? Seeing none, do we have a motion? Do we have moved and properly seconded? Those in favor? Any opposed? Any not voting? So we've got 1, 2, 3, 4, 5, 6, 7, 8 in favor, 0 against, 0 not voting to approve the consent agenda. We're going to go a little out of order just for time purposes. First item we're going to take up is agenda item number 12. Which is BL 2026-1627, sponsors Weiner, Rutherford, Huffman, Evans, and others, an ordinance to amend certain sections of Chapter 2.114 of the Metropolitan Code of Laws pertaining to the Metropolitan Animal Care and Control Commission. Do we have moved and properly seconded? It is properly before us, and I'm going to go to Councilmember Weiner. You're recognized.
Thank you so much. This is pretty easy, and I'd like to just share quickly what it does. It takes the words June 30th and changes that to the end of August. for the annual report. And the reason is operationally for them to try to give us an annual report right at the end of the year and the start of a new year, that's asking a whole lot. And so we decided it made sense to just move that to the end of August. So August 30th will be the new date. So that's thing number one. Thing number two that this does is it helps us to broaden the pool of potential applicants to become commissioners for MAC under the header of Animal Care and Control Facility. It did say animal shelter, but because we need a broader pool of people and we have one truly open shelter in the county, that really limited the people that could apply for the position. And so we wanted to change that to animal shelter. Not animal shelter, hang on, I'm sorry, I said it backwards. Animal care facility, I'm sorry. So animal care facility. So that's all it does. Doesn't change any numbers, doesn't change the composition, and it's pretty straightforward. Everybody agrees with it, which is good.
Having heard an explanation, I do see Councilmember Evans. You're recognized.
Thank you. I just actually wanted to ask a process question. So with this revision, and once this passes, then will interested people be able to go online and do the submission and all that stuff, send their resumes in? Okay. Thank you.
All right, any further discussion on this item? Seeing none, we'll move to a vote. Those in favor? Aye. Any opposed? Any not voting? We've got 8 in favor, 0 against, 0 not voting. We recommend approval. Okay, going back, we will now take up agenda item 1, which is RS 2026-1902, sponsors Toombs, Huffman, and Gadd, a resolution authorizing the Metropolitan government to settle opioid-related claims with remnant defendants. Do we have a motion? Moved and properly seconded. Any discussion? Seeing none, we'll move to a vote. Those in favor? Any opposed? Any not voting? We recommend approval with a vote of 8 in favor, 0 against, 0 not voting. Next is RS 2026-1907, a resolution appropriating a total of $375,000 for a certain account of the Community Safety Fund for a grant to Gideon's Army, Grassroots Army for Children to implement a trauma-informed, youth-led workforce and leadership program for youth to reduce and mitigate violence as part of the Community Safety Initiative. Sponsors Toombs, Huffman, Coopin, Welsh, Allen, Gadd, and others. Do we have a motion? Moved and properly seconded. Any discussion on this item? Councilmember Bradford, you're recognized.
Thank you. If there's anyone here representing Gideon's Army, I just have a couple of questions that kind of residual from the issues that were reported by the media and a couple years ago, mainly that there were multiple employees who were found to have active gang ties or weapons while they were on the payroll of Gideon's Army. Have those personnel issues been resolved?
Hello.
If you could introduce yourself for the record.
My name is Rashida Fatuga. I am the founder of Gideon's Army. First, I have 2 of our youth leaders who are here with us today. I want to first say thank you for your consideration. I would say yes, those issues are resolved very confidently, and also that none of our violence interrupters were found with having any issues, but we did have 2 people who were a part of the program. So they were actually contractors in national CVI models. They have people who are still, working through issues. They're a part of the program. They're also credible messengers who can, impact things with the youth, but our people were not there yet. They were still in training. They were not full staff, not even making more than a couple $1,000s a month, but the goal was stability. They were also referred to us by some city agencies that asked us to take them. And so if anybody has any questions, I am fully transparent. I'll tell you anything you want to know. Y'all can come to the Giz store that the youth have put together to be open, a soft opening on Thursday, 1625 23rd Avenue North. But our staff were very impeccable. And you will see, as far as the concerns about guns or anything like that, none of our staff members had any of those issues. And I'm open to any other questions. Thank you for asking.
I appreciate the answer. I appreciate transparency. Two more questions. These would, I think, will be directed towards the administration. What Metro Department is the responsible party for monitoring compliance on this grant, the reporting interval, and does it include a clawback provision if benchmarks are not being met?
Administration.
Thank you, Chair. Council member, I believe the applicant has been working with the Department of Health, and I believe we have somebody from Health here who can speak to that. Okay.
You're recognized.
Thank you. Cabrera Leach, Health Department. Can you repeat the questions that you had?
Yes, the question is, with the Health Department now being identified as the responsible party for monitoring this grant, what are the reporting intervals, and does it include a clawback provision if benchmarks are not being met or irregularities are discovered?
There is a reporting interval. I actually have the contract here right in front of me, but I am not well versed in this since I didn't work on the contract myself. But what I do know is that when putting this together and taking into consideration the seriousness of giving this large amount of money to a community organization, we worked with them to make sure that they had their proper liability insurance, made sure that this was a very stringent agreement where there was a scope, where there are deliverables, so that we're being good stewards of the money of this city. As far as the details, specifically a clawback clause, that I don't know about, but I can find that out for you. If you can give me a few minutes, I can literally go through this document and get back to you. But yeah, we did make sure, due to, I guess, just trying to be more organized than things have been in the past when it comes to giving out grants, managing funds, that we are going through these things with a fine-tooth comb to make sure that there's accountability.
Chair, I believe Representative from Gideon's Army was willing to answer that second part.
Yep.
It's Rashida again. Yes. So if we don't meet the benchmarks, y'all can have the money back, but we're going to meet them benchmarks. It's a standard Metro contract also where, I mean, honestly, it can be rescinded at any time. So y'all don't have to deal, it's just open. And so we're not going to quit on y'all. Hopefully y'all won't quit on us. And we haven't quit on this city in all of these years. It has not mattered how hard that it has gotten. And contrary to popular belief, I mean, you really can't believe everything you see on the news if you want to know the truth, that our benchmarks have actually been like really solid. And so again, if anybody wants to come in, I would love it. I love talking to people one-on-one. I don't like big crowds though. But yes, it can be rescinded at any time.
Thank you, Chair. I had one more question, but at this point, I think from the questions and answers we've had, that's been answered, and I do appreciate the opportunity to ask them. Thank you.
All right, thank you. Councilmember Suarez, you're recognized.
Thank you, Chair, and I want to thank Councilmember Bradford for those questions because I think it's good to have them on record. But I just wanted to stand and say that I'm very much in support of this grant. As somebody who was part of the group that worked on it from last term, it started with $1 million. It was good to actually see it materialize. But I also want to get on record that the way that this violent crime intervention works is actually through the use of what we call credible messengers. The program nationally believes that you have to use people that have experienced this, that have done it, that can actually relate to the youth. Most of the youth in this program would not relate to police officers or people that, oh, somebody like me telling them, put your life together when I don't know what it's like for what they've been through. So nationally, the national model is to use these credible messengers. And when you're using people that have been in gangs or been in jail around students, yes, you will have things like what the news media is reported on, or you have one or two individuals that have done things. But I do not want those stories or one or two stories to put a stain or a strain on the work that Gideon Army has done for this city. Gideon Army is the first, one of the first, if not the first organization that has actually started violent crime interruptions in Nashville. And they've been doing it for such a long time, and they've done a lot of amazing good work with the youth. I can attest to that. And so I want people to understand how this program works, but I also want them to understand that we cannot use one or two people that is supposed to be part of a program that falls short to now criminalize or be against the program. So, but I'm glad that the health department has the deliverables. There's a lot of, it's community money we have to ask, and that all of that is in place. So, but I'm quite in support, and I'm glad with the responses from them and from the health department, and ask everyone to support. Thank you.
Thank you, Councilmember. Next, we're going to go to Councilmember Evans. You're recognized.
Thank you, Chair. I've got a question for Ms. Fatuga, and I really appreciate you being here today. And can you speak more about like the program itself? How do young adults get involved? Do they self-select? Like, how are they raising their hand and saying they want to participate, and kind of describe a little bit how it works?
Well, I am really excited about this program, Get University. It was birthed out of our work at Pearl Cone and McKissick, Metro Schools, but deeply rooted within the community. Honestly, the kids often do self-select. They come because we've had this long-standing history. We have John here. John, how old were you when you started with Gideon's Army? 14. 14. How old are you now, John?
24.
24. So they come and they stay, and then they bring their cousins and their brothers and their sisters. And so, but we also have partnerships with other community organizations. We have judges, juvenile detention, a lot of times because we're there. And so if there's someone who has a need, and a lot of times we know the kids, and so they can call and say, hey, there's this kid that's having a problem, or this kid has asked for you, and then we'll go in and we'll be with them. Also, we have a partnership with Vanderbilt trauma physicians and at the different hospitals. But if Vanderbilt, of course, they're the level 1 trauma for the region, so most of our referrals come from them. But if a person is shot and survives, then we are called in. We do quality of life care, which means that it's not just hospital-based violence interruption. We are making sure they make it to their appointments. We're making sure that pain management, they're following up with that to hopefully reduce addiction to painkillers, all of these things. But once they are restabilized, then they have the option to be a part of the program as well. So we have several different partners, but a lot of times we don't even have to.
Thank you very much.
Right, thank you, Councilmember Evans. Next, we are going to go to Councilmember Toombs. You're recognized.
Thank you, Chair, for recognizing me, even though I do not serve on this committee. I stand in support, as I have for years, of Gideon's Army and of this grant. As Ms. Fatuga mentioned, Gideon's Army has been a part of the North Nashville community for well over a decade, if not going on 2 decades. And in terms of this grant, which I have been working on since 2021, they have jumped through all of the administrative hoops, and health, fortunately, is on board and will be following along with the metrics and keeping the data. And I look forward to seeing more of the good work that Gideon's Army has been doing in the community. I've met many of the young people who are part of Get University. Gideon's Army reaches out to those that most would throw away. And so they are vital to the community and to these young people having an opportunity to live a productive life. And I ask that my colleagues support this grant. Thank you.
Thank you, Chair Toombs. Next, we are going to go to Commander Nash. Once I find you on the board, there we go. You're recognized.
Thank you, Mr. Chair. My question is, we've heard a lot about deliverables and metrics, and could we have an explanation of what maybe the top 3 deliverables are?
I'm not sure if the administration or if health would be most equipped to answer that. We're going to go to health. I'll keep filibustering to give you a moment to get to the podium and find exactly what you're looking for. I will state, too, with relation to Gideon's Army, that separate and apart from their violence interruption programs, they do a lot of really great work in the legal community as well, making sure that folks who are practicing in the realm of criminal defense have the skills and experience that they need to adequately represent their clients and coaching up new attorneys through some of their programs. So Gideon's Army truly is an incredible organization that does a lot of really important work, both here in Nashville and across the nation. But definitely want to commend you all for the work that you do here in Nashville with the violence interruption and making sure that you're really providing those services to the community. And as Chair Toombs stated, for folks who oftentimes are overlooked. And so with my filibuster, it looks like health might be ready to answer. I believe the question, actually, I'll go back to you, Commander Nash, to re-ask the question just so we have a clear through line.
During our discussions this evening, I've heard a lot of reference to deliverables and metrics. I'm curious maybe what the top 3 of the deliverables are.
You're recognized.
Okay, Cabrera Leach, Health again. Okay, so starting here at the scope of the program, and I believe you guys should have a copy of this via PDF. They're enrolling 30 participants and maintaining an 80% retention rate for youths age 24 and under. Second, 75% of participants will show improved coping and emotional regulation on cognitive and dialectical behavioral therapies. Third, provide 500 hours per participant in structured workforce development experiences. There's a longer list. I think there's about 6 more bullet points, but those are the top 3 in terms of the deliverables that they would need to provide. And I just wanted to jump back a little bit in terms of the last question. Rashida answered it a little bit, but the termination for cause is on page 3. It's D3. So for any reason that they don't meet these obligations, automatically all money spent needs to go back to the city, just to concretely answer that question.
Thank you. Is this a reimbursable grant, or is this we give you the cash and we'll monitor you later?
No, this is an upfront payment grant.
So there'll be a check for $385,000?
The actual payment structure of it, let me see over the number of years. Yeah, $375. And I do apologize. For some reason, we printed out an agenda where the meeting started at 4:45 yesterday, and today it said 4. So your actual expert is not here, and unfortunately, you just get me, but I will try the best that I can.
I will state I am getting guidance that this is a reimbursable grant.
Reimbursable? Okay. Thank you.
And then they received a smaller grant this past year, is that correct? No? Okay. Never mind. Thank you very much for the questions.
Right, thank you. Councilmember Gadd, you're recognized.
Thank you so much, Mr. Chair, and I just wanted to rise in support on my way over here, able to listen to some of the earlier questioning and some of the presentation, but wanted to thank my colleague, Chair Toombs, for her continued work on this, making sure our communities that are most vulnerable and often overlooked have folks that live and work within that community to help with these, with the access for success. So thank you, Ms. Toombs. Before I got on this council, I was aware of Ms. Toombs' work here, but also aware of Ms. Fortuga. So, Richie, it was a pleasure to be able to walk in and see you speaking on this. And thank you all so much and look forward to supporting this.
Thank you.
All right, thank you. Any further discussion? Seeing none, we'll...
I know you weren't talking to me,
Go ahead. Yeah,
Okay, thank
you're recognized.
you. I just want to say thank you again. And you asked about the deliverables, but I want to make sure y'all kind of understand the program, if that's okay. So Gid University is a service leadership program. I was an Ingram Scholar at Vanderbilt University, and it's something that I'm very proud of. It's something that really changed my life. Because of course, one, I came out of college with no debt, but all of the leadership and the service leadership opportunities that were afforded to us, it just wasn't anything that I'd ever experienced. And I was always very active as a student. I went to boarding school, went to college, all of those things. And so where my heart is in really trying to duplicate the experience that I had as an Ingram Scholar, because in a lot of programs, what they do is you take all of these classes, you do leadership development and all of this, but you don't get to put it in action. You don't get to practice what you've learned. So you get a certificate to say that you did anger management or that you did 20 hours of leadership development, but you've not been put in positions to do the work. And so from our earlier cohorts that were more of pilots, the youth formed a partnership with Vanderbilt Children's Hospital. They did focus groups with youth and their families who are gun violence victims. Then they came and they presented to Vanderbilt Children's administrative team. So it was the executives, it was trauma physicians, it was the nurses, social workers, with the families sitting around all of these tables and talking about the findings. They just had a meeting, I want to say 2 weeks ago, to then work with them to do a program map, a patient map on exactly what happens when you go through, have an experience when your child has been shot. And so we've traveled to Detroit and we've been part of national conversations. John was one that went with us. And now we've published in partnership with national organizations the CVI Action Plan, which is how do you implement community violence intervention models citywide. And our young people from Nashville were there and contributing. So there's so many projects that they've done that I could tell you about, but those are two that are two of their favorite experiences. You do? Okay. Well, can he say something real quick? Y'all gotta go. He told me to be quiet.
I wanted to answer his question. A lot of our youth come from families that have gang violence or gang family members in it growing up. If that's your only inspiration or the person that you look up to, that's where a lot of the paths start from. So that's what we are looking for, to change the path or show them if this is the path that you're gonna go on, it's a right way to do it. It's not just violence. Because I was raised in a gang family or just around a lot of violence, but it's the path that you choose. And if it's no one around you to show you the right way on the path that you're going, because I know a lot of gang members, but the gang doesn't make you who you are. So, and I can say about our gang violence, it's so many different gangs now or cliques or however you want to call it. But our youth is the ones that's actually involved in it. So without us being able to reach the youth, that's what we are looking for, to change the youth and show them it is a better way to go down a path of gang members, or because you can't stop them from doing it, but you can show them a better way or a change, the right way to go about it.
And research says that youth having a sense of purpose is one of the biggest positive indicators for change. And so our program really helps them to feel proud of their work. John and Kiera, they are the leaders for opening the Gid store. There are not more kids with us here right now because they're there. It's called Blackout North. It's a little black building on the corner that we bought in 2020, 23rd and Osage, but it's a cafe, so they'll be cooking hot food. We've got a music studio and a fresh food market as well. And so we have partners who will be coming in and doing workshops with them around tech, partner with other organizations, and also leading our own for public health and construction, electrical, like it's a lot of great stuff. Landscaping, there's a lot of good stuff going on. So I just invite y'all to come out. I'll send y'all the email.
All right. Thank you all. All right, Commander Nash.
Yeah, just one more. Is any part of your program have anything to do with trying to build better relationships with our police department?
The short answer is no. However, Commander McLean was a really great partner, and I really appreciated his partnership because honestly, we had a really great working relationship. The same with Commander Graves. We just had a really great relationship, but our program just isn't designed to help people like the police. That's a lot of pressure for a little community organization. Their budget is way bigger than ours. And so just for us to come in and spend manpower on that is a lot. And when we started MNPD, honestly, when we first decided to start working on violence intervention, we opened it up for any and everybody to come and participate. So 2018, we brought Cure Violence down to Nashville, and we did a three-day kind of workshop. We were in 3 communities, but we held 2 two-day workshops about violence intervention, violence interruption. And MNPD, Metro Arts, like all the agencies showed up. We are not adverse to partnerships, but there is a certain way in community violence intervention, especially national models where you work with the police, but it has to be a certain type of partnership, even for our own safety and credibility as we navigate through the community. And so, yeah.
Thank you for that. I'm going to go to, or do you have a brief follow-up?
Just a brief. While I was commander of the East Precinct, Michael Joyner was a reverend who,
yes,
and he was doing violence interruption before it had a name. Really worked hard with us to. Have you been working with that group? I mean, that seems like somebody.
He and I actually are very, I would even say close. Like, yes. So, I mean, we're not adverse to partnerships, but with the national CVI model, the ways that we've been trained, and also, I mean, we had meetings, Commander McLean with national partners to make sure that our partnership looked the way that it needed to, in line with how the best practice CVI models work across the country. And we're just very committed to staying close to best practices. But yes.
All right, thank you. Chair Toombs.
Thank you, Chair. I just wanted to point out that there are multiple organizations that work in the violence interruption intervention space that have grants with Metro Health, and none of them have a requirement to foster positive relationships with the police. Not that that is a bad thing, but that is not a requirement for any of these organizations. They all have been brought in for the expertise that they lend to the total problem of gun violence in our community and getting our youth on the right path. So let's not hold one organization to standards that others aren't held to. So I just wanted to point that out, Chair. Thank you.
All right, thank you. With that, we are going to Councilmember Druffel.
Briefly, I know you've been asked a lot of questions, and I really appreciate what you're doing. The health department has a behavioral health group that works on high ACE scores, which is very similar to what you're doing. Have you had a chance to discuss some of this with them? They have a lot of public health professionals. I know you got a very unique situation. I just wanted to throw that at you because they have a lot of people in there that might be able to support you in some way.
Thank you. We do intend to meet again, but I think everybody's energy has been put in just getting this prepared. But I've met with everyone, and I'm so grateful for Metro Public Health, for the work that they do, for the support that they've offered, because this work is really, really hard, y'all. Like, if you can imagine having a kid that you've been with every single day and everything's perfectly fine, and then you get a phone call, you're jolted out of whatever it is that you're doing, and they've been shot, and you got to go to the hospital, and all of those, I was burnt out. I was very burnt out. And so the support that I've gotten from those of you and from Metro Health have in so many ways been the wind beneath my wings. And my kids, like, they'll just pop up. Like, you know, they call me Mama Rashida. Like, Mom, you got to get up.
Okay, thank you very much. I just wanted to make sure that that was something that you could use as a resource, but good luck to you, because it's hard work. I appreciate
it. It is very hard work, and they are very here for me. I feel very supported. I feel very supported all around. I'm very grateful.
Thank you. We'll now move into the vote. The questions have been called. All those in favor? Any opposed? Any not voting? We recommend approval with 9 in favor, 0 against, 0 not voting. Thank you all so much for being here.
Thank you all so much.
All right, next we will move on to agenda item number 4, RS 2026-1909, sponsors Toombs, Huffman, Coopin, and others, a resolution appropriating a total of $180,000 to Room in the Inn Incorporated, and approving a grant agreement between the Metropolitan Government of Nashville and Davidson County, acting by and through the Office of Homeless Services and Room in the Inn Incorporated, for the provision of day shelter and guest house services to provide shelter, food, clothing, navigation to resources, and other programs for people experiencing homelessness. Do we have a motion? Moved and properly seconded. I do see Chair Toombs here. We do have a letter from Chair Toombs asking for approval, but do you want to address this? Or okay, it's been moved and properly seconded, properly before us. Any discussion? Seeing none, we'll move to a vote. Those in favor? Any opposed? Any not voting? We've got 8 in favor, 0 against, 0 not voting. Recommend approval. Next is agenda item number 7, RS 2026-1913, sponsors Toombs and Huffman, a resolution approving an intergovernmental agreement by and between the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Nashville Police Department, hereafter MNPD, and the Army Corps of Engineers for extra duty police services. Do we have a motion? Moved and properly seconded. Any discussion? Seeing none, we'll move to a vote. Those in favor? Hold on a second. We're getting a little skinny. Okay. Those in favor? Any against? Any not voting? We've got 7 in favor, 0 against, 0 not voting, recommending approval. Next is agenda item number 11, RS 2026-1917, sponsors Toombs and Huffman, a resolution approving an application for a local law enforcement crime gun intelligence center integration initiative grant from the U.S. Department of Justice to the Metropolitan Government, acting by and through the Metropolitan Nashville Police Department, to strengthen and expand the crime gun intelligence center to more rapidly identify, investigate, and prosecute perpetrators of firearms-related violent crimes through enhanced technology, personnel capacity, and interagency collaboration. Do we have a motion? Moved and properly seconded. Any discussion from the committee? If we could have Chief Gilder, if you could come forward very briefly. I had reached out to Chief Gilder with some of the questions that I had on this grant application. He provided me with those answers ahead of time, but just wanted to get those on the record. Chief Gilder, if you want to just introduce yourself and tell us sort of broadly about this grant and the CGIC, sort of what it is and what MMPD does. Oh, wait, there you go. You're recognized.
All right, thank you. Chris Gilder, Metro Police Department. So this grant's a new one for us. It's a application for $300,000. There is no match on it. And what it does is it funds a couple of purposes. One is the overtime that detectives in our Specialized Investigations Division use. that work neighborhood shootings. They work closely with homicide and on aggravated assaults because unfortunately, a lot of times the guns that are used in one incident are traced to another incident, and then we end up finding and recovering those firearms. And so they utilize a system called NIBIN, which is the National Integrated Ballistics. I got the full thing here somewhere. The program that where basically they do topographical scans of the shell casings, and it's like taking a fingerprint of the casing. And so it allows them to match casings from one crime to another and eventually to suspects. And then also, in addition to funding that over time, it would fund the brass tacks machine that actually conducts those topographical scans, allows us to input them into NIBIN.
Perfect. Thank you. Having heard an explanation, is there any further discussion from the committee? Councilmember Suarez, if we could have you stick around for a minute. Sorry, we're right at quorum. Yeah. Yeah, we're still right at quorum. Sorry. Okay. Sorry. Having heard the explanation, any further discussion from the committee? Seeing none, we'll move to a vote. Those in favor? Any opposed? Any not voting? We've got 7 in favor, 0 against, 0 not voting. We recommend approval. And then last legislative item on the agenda, bills on second reading. This is BL 2026-1328, an ordinance to amend Chapter 10.64.018 of the Metropolitan Code to establish an update fee schedule for the Fire Marshal's Office. Sponsors Toombs and Huffman. Do we have a motion? Moved and properly seconded. Any discussion? Seeing none, we'll move to a vote. Those in favor? Any opposed? Any not voting? We've got 7 in favor, 0 against, 0 not voting. Okay, that concludes our legislative agenda. Next on the agenda, we do have a presentation and report from the Central Business Improvement District and the Midtown Business Improvement District. If the representatives from that are here and ready to present. I believe the microphone back there is still on us, so if you could just introduce yourself for the record and go from there.
All right,
You're recognized.
I appreciate you all. I'm Tom Turner, President and CEO of the Nashville Downtown Partnership, presenting for the Nashville District Management Corporation's Central Business Improvement District. Central Business Improvement District operates in downtown Nashville, neighborhood we all share, and provide services within the improvement district in downtown. Services include daily cleaning, safety, economic development, communications. They're in addition to the base level provided by Metro government and are funded by additional fees and additional assessments paid for by businesses and property owners within the boundary of the district. These services are provided to a downtown now home to 23,000 residents, 88,000 employees and growing as of today, and 17 million plus visitors from near and far. And downtown provides 12% of all property taxes in Davidson County and 18% of all Metro sales transaction revenues. Downtown was #1 in overall recovery, top 25 U.S. cities, from pre-COVID numbers to post-COVID numbers. Overall measurements included residents, employees, and visitor counts compared to 2019. And today, I'm presenting the initial public safety report as outlined in Metro Code 2177062. The Metro Code amendment from July 15, 2025 allowed us to prepare a report for the fourth quarter from October 1 to December 31 of 25. And future reports will be presented annually in April, covering the full preceding year. The report is very prescriptive. It goes with quantitative data and qualitative data. You all should have received a copy that was sent to the council in the last day of March. Some of the highlights, and starting from the top on the quantitative data, we were asked to document the number of interactions between CBID-affiliated security officers and unhoused individuals. There were 91,000 documented interactions between all CBID-affiliated security officers with the public. Those CBID-affiliated officers include block-by-block safety ambassadors, Solarian risk management security guards, and Tennessee Highway Patrol personnel. The vast majority of the interactions with the public were by safety ambassadors, 88%. Of those, 12,000 or 15% indicated interactions with unhoused contacts. Additionally, the block-by-block outreach team, which we were not asked about, reported 23,000 interactions with unhoused individuals. Solarian security guards documented 137 interactions with the public. They do not document information related to housing status, and the Tennessee Highway Patrol documented 11,000 interactions with the public, and they also do not capture information relating to housing status, and nor does the Metropolitan Nashville Police Department. I hope this is the format you were expecting.
Yes.
Okay. Yeah. Item B, number of incidents resulting in use of force, detainment, or law enforcement referrals. There were no reported use of force incidents. There were 23 reported detainments, which are arrest, 23 in 92 days, quick math, 1 every 4 days. And there were 268 referrals to law enforcement, which could be either Tennessee Highway Patrol or Metropolitan Nashville Police Department. Item C, number of complaints or grievances filed against CBIT-affiliated security personnel involving individuals experiencing homelessness. No reported complaints or grievances regarding interactions were received. Item D, number of reported injuries or medical responses following security interactions. No reported injuries or medical responses. And item E, number of referrals made to social services or outreach teams, 68 referrals to social services and or outreach teams. And number and types of trespass warnings or exclusions issued to unhoused individuals. We don't issue exclusions, but there were 5,000, approximately 5% of the total of the interactions were related to what we call trespass interactions, primarily education. There is a large amount of information on qualitative data. I'm happy to go through all of it. It's less quantitative and more anecdotal, but it's your choice, Chair.
Perfect. What I want to do is pause really quickly and go back because I've got one question as it relates to item number B. So you talked about the number of detentions or detainments that took place and then referenced 268 referrals to law enforcement. Of those referrals to law enforcement, did those result in further enforcement actions? So either taking a person into custody or issuing them a criminal citation? Do you have those kinds of numbers?
And everything that we have that resulted in an arrest or is considered a detainment would have been the 23 that were reported. The 268 are, the 23 would be part of the 268, which, as you know, all interactions with the police department or Tennessee Highway Patrol do not result in an arrest.
Okay, perfect. Understandable, but I guess sort of narrowing down, of the 268 folks who received some kind of referral to law enforcement, do you have any data on the number of criminal citations issued or sort of what all encompasses a referral to law enforcement?
I don't.
Okay, completely understandable. Like we can follow up to get that data. Yeah. But yeah, if you want to walk through the, or let me pause and see from the committee, are there any questions on those items that were just presented? Seeing none, we'll go through the qualitative data.
Great, thank you. And qualitative data ask for details on security companies' use of force policy, de-escalation training, homeless management protocols, and for Solarian, which provides a small number of security guards, their policy, and as most everyone's, use of force, last resort, only when reasonable, necessary, and proportional, protect life or achieve a lawful objective, and must be stopped immediately when the threat ends. Personnel practice manage mandatory de-escalation, calm communication, distance time, resource activation, and then paraphrasing, when engaging individuals experiencing homelessness, mental health crisis, intoxication, or other vulnerabilities, staff must prioritize patients' communication safety, avoiding physical contact unless there's an imminent threat, and primarily calling EMS or law enforcement early when appropriate. Solarian security guards meet or exceed the minimum training required by the state of Tennessee Private Protective Service personnel. Solarian did not report or receive any misconduct complaints or issue any disciplinary actions on the security officers deployed within the CBID while working in a capacity for the Nashville District Management Corporation / Nashville Downtown Partnership.
I'm going to interject really quickly because I've got a question that just came to mind. As it relates to the utilization of off-duty THP officers, have there been any documented incidences over the past, or that you're aware of any interaction or cooperation between off-duty THP officers providing security for either the downtown bid or the MBID and interacting with any federal law enforcement, specifically ICE?
Not that would be permissible. My understanding, and I can look at Commander Nash, is that appropriate? My understanding is that anytime that there is an intergovernmental relationship between, whether it's local, state, or federal, that all of those officers would have to be considered on duty at that point in time to participate in any intergovernmental activity.
Thank you for that.
Is that correct, sir?
That's Commander Nash retired.
Yes, sorry. Yes.
Back in 2014, so it's been a couple of years since I've been there to the, I'm not sure I could comment exactly the nuance,
okay.
But I think you may have that interpreted right. But.
Oh, thank you. Sorry.
More than okay.
We also provided case studies for both Solarian, or not both, but all three of Solarian, Block by Block, and Tennessee Highway Patrol of interactions with our outreach team and with the homeless community. And I think I'm on item D for Solarian. I believe that's where we are. Description of training provided to security personnel regarding humane treatment of homeless individuals, trauma-informed care, or mental health crisis. Solarian risk management policy does not use a specific term, homeless. However, their guidance for behavioral health vulnerable individuals and de-escalation directly applies to all individuals, whether homeless or not. Key principles including dignity, respect, patience, communication over enforcement, and problem solving and persuasion rather than generating commands. And again, I'm summarizing because I know we're up at 5 o'clock. Item E, summary of any community engagement efforts or public forums held to address safety and rights concerns. There were no community engagement efforts or public forums for that topic. Block by Block is the next section. Again, a very similar de-escalation, use of force policy training, minimal force focused on service, safety, and disengagement, not enforcement. They are not involved in enforcement. Physical contact is used only in self-defense to create space and remove themselves from the situation. Item B, the summary of disciplinary actions taken in response to misconduct, if any. Block by Block did not report or receive any misconduct complaints or issue any disciplinary actions to their security officers deployed in the CBID while working in capacity for the Nashville Downtown Partnership. A number of case studies are also included as well on item C. And for both Block by Block and Tennessee Highway Patrol, item E, there were no community engagement efforts or public forums addressing safety and rights concerns.
Right, thank you for that overview and summary of the report. Are there any further questions from the committee? Seeing none, are there any, do you have any final statements that you want to share with the committee?
Well, I thank you all for being here, thoughtful consideration, and for really allowing us to compile the report. We noticed a lot of things that were really meshing well, and one item that didn't, that wasn't being documented, which you will see the fruits of that in the future, and that was the calls that were going from block by block safety ambassadors to the outreach team, for some reason, were not documented. But we caught that when compiling this report. So that number we thought was crazy low, and we looked into it, and there wasn't actually a button on their phone for that. So I'm probably oversharing, but we did learn through the process, so thank you.
Yep, appreciate you identifying that gap and taking steps to remedy it. All right, seeing nothing further from the committee and nothing further on the agenda, do we have a motion to adjourn? Or wait. Oh, sorry, I stand corrected. Ms. Howler, if you want to come forward. And if you could just identify yourself for the record.
Good evening. Thank you, Vice Chair. My name is Lisa Haller. I serve as a board member elect on the new Midtown Business Improvement District, and I am here with my colleagues. Also, it's coming up. Oh, here they are. Also, our board member elect for the MBID, and we are actually due next door to go through our interview with the Rules and Confirmations Committee in just a moment, as soon as we finish here. Thank you all very much for having us. Thank you also to the full council for your support of the MBID. It was a great evening here on December 16th, right here in the chambers, when the council approved the legislation, the enabling legislation to form and establish the Midtown Business Improvement District. You all voted 30 in favor and really showed a great support for us. Given that the enabling legislation then was signed by the mayor on December 17th, we started to kind of switch our gears from our steering committee to work towards an annual meeting and a board election, nomination and board election process. And that did take place on March 23rd, 2026. We had our first official board election and annual meeting of our property owners. Our MBID, the boundary of our MBID, if you all may not be familiar or remember, we do start just west of I-40, where the C-bid and the G-bid end, and that's where we begin. So we had our annual meeting on March 23rd. Our board-elect, many of which are standing behind me. We have 15 voting board members and 5 ex officio board members, 3 of which are represented here from Metro Council, whose districts include any portion of the MBID. As required by law, we have a state representative and a state senator whose districts contain the majority area, that means land area, within the MBID. So that will be Senator Jeff Yarbrough and State Representative Afton Bain. From council, you all will be represented with Councilmember Jacob Coupin, who was the lead sponsor for the legislation, Councilmember Terry Vo, District 17, and Councilmember Tom Cash, District 18, who was waiting for us next door to do our interviews. Once we go through the interview process in just a couple of moments, we will hopefully all advance to, as part of the 2-meeting process, to come before the full council for your all's approval on May the 7th. At that point in time, we will be official as an MBID, being able as a board to actually govern the new district and start to begin lots of priorities that we have in place, which will be to consider how we operate our staffing and so forth. So at this point in time, to the Public Safety and Health Committee, we are here to report that we don't have any interactions to report. We did submit this in writing to you all on last Friday. The report per the legislation is due to you on April the 30th of this year, so we got it in early. So our report, which you all probably have received, states the same as we just mentioned, that there is no activity to report to the Metro Council Public Health and Safety Committee, and as such, there is no activity to be made available to the public via a website or otherwise. We very much appreciate this opportunity to be here, and if there's any questions or if you would like us to come back, we would be happy to do so. So I will also ask if my colleagues have anything to add?
All right, thank you all so much.
Any questions?
Appreciate it. Anything from the committee? Seeing none, thank you all so much. We won't hold you over too longer. We'll see you in roles. So thank you all so much.
Our pleasure. Thank you all so much.
All right, is there anything further from the committee? Seeing none, do we have a motion? All right, without objection, we do now stand adjourned. Thank you all.